Next thing is timing. Depending on what implant system you use, there's all these different shapes on the inside of it. Trilobe, there's the Straumann internal, there's the internal hex, the internal conical hex, this weird one that I've never seen before. If anyone can call it out, that'll be cool. But usually we have to keep in mind that this shape on the inside of the implant is responsible for orientation and basically communication to the lab, depending on what you're doing with your restoration. And a lot of the times it doesn't matter, but sometimes when it does matter, that's when you're like, dang, I should have marked my timing, I should have planned for my timing. So this indexing system, we're doing a lot of pre-printed temporaries. When we're pre-printing a temporary, for example, in the anterior is the area that you most likely want to pre-print a temporary tooth for a patient. That's taking into account your hex orientation of your placement already. Because you're designing, for example, number 9, a tooth that, it's wide in the front, it's narrow on the sides, you have contact points. If your internal hex is not accounted for, your pre-printed restoration is going to have an arbitrary insertion point into the implant. So you're going to be putting the tooth in, it's going to be either sideways one way or sideways the other way. Because these hexes, I'm not big into trigonometry, what angle apart these hexes are, but it's, if it was a 12-sided hex, then maybe it wouldn't matter too much, but having the amount of sides here, you either have to shave the hex off if your pre-printed temporary doesn't fit, or just use a stock healing abutment. To make it easy though, let's account for our timing, and we can do that easily with Blue Sky Bio. So a way to do that is, like we said before, you use your mouse, your right mouse button, rotate the view so you see your guide tube from the top, hide all your abutments, hide your guide tubes, and all you want to visualize is the implant fixture and the guide that you're using. So when you see it from the top, and we can go through this later on the hands-on portion, you can select in the implant surgical guide panel on the right side, there's an area that says mark guides. So that marking, you can write anything you want on it, and it transfers that the certain thing you write onto the surface you created. So what we use that most for is labeling the implant. For example, you can put in Biomax 4.3 by 10 for one side, and then whatever size you're using for the other side. Another thing you can do is, it's kind of like a hack of the system. You place a letter I or lowercase l or number 1, whatever has a line on it, align it to a flat portion of the hex, and then click apply to the surgical guide. It'll actually mark the surgical guide before you print it. And then after you print the surgical guide, it's not going to be super dark. So my preference is to mark it with a Sharpie afterwards, so it's nice and dark. And this picture here I used before, let's zoom in. That's the letter I on the surgical guide, and we marked it afterwards with a Sharpie. So nice and easy to see. You have your timing accounted for, and all your pre-printed restorations. And for example, if you're using multi-unit finals, they're going to be accounted for. And that's actually one other thing that I didn't mention about timing. It's super important for full arch cases. So for full arch cases, we're going to be using multi-unit abutments. And if you're not using straight multi-units, if you're using 17 degree, 30 degree, they all are very, very sensitive to the timing of the implant placements, because your posterior ones are going to be angled. To account for the angle, you have to predetermine where those temporary cylinders have to be exiting and where the angles of the angled multi-units are going to be coming out from. For my first case, I was a little bit ignorant about the subject, and I was like, you know what, I planned the implants, I have a guide, timing, I'll just kind of, I'll take a look inside and see. I also pre-printed a pickup that same day. So the anterior ones are just fine. They're straight 0 degree multi-units, so it doesn't matter where your temporary cylinders are. The posterior ones were 30 degrees, so playing around with angulation, I really had to bore out the model I pre-printed to pick it up, because those original pickup holes I made through my denture were not lined up anymore. just because the timing was off. It wasn't accounted for in the guided surgery.